So sometimes I like to think of OCD as having a bully in your brain. And I often will ask clients if they saw the movie 8 Mile. And there's a scene in 8 Mile where Eminem kind of goes up to the rap battle, and he gets up there and he starts calling out all the things about himself. I live in a trailer, da, 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 da. I'm poor, I'm this, I'm that, and the other thing. And he beats the other guy because when it's the other person's turn, they have nothing to say. So I like to think of if OCD were a bully and you were in 7th or 8th grade and the bully comes up to you and says, well, you're so this. If you can beat that person to the punch and say, you're right, yes I am so this. What else you got, brain? Eventually the bully runs out of steam. So it's kind of about, if you can kind of preempt your brain before it gets there, if you can kind of treat it as kind of beating a bully to the punch, the bully won't have anything to say. With a mindfulness exercise, sometimes I'll have clients, I'll think about them in terms of when you're skiing and you hit a patch of ice. The worst thing that you could possibly do at that point is attempt to control the skis or attempt to control what you're doing. Or if you're driving in a car and it's snowing out and you hit a patch of ice, what they tell you to do is let go of the wheel. If you try to control the car, you'll throw yourself directly into a skid. But if you let go and go through the ice, you'll wait till you can kind of get a patch where you can get your footing again. And so OCD is kind of in the same way, that when you're spiking, when you're full in a spike, you can't really think of which way to go, just to do nothing. Just to completely let go, let it be there, let it pass through until you kind of get to a point where you can kind of dig in and do your therapy again. For people whose spike themes switch around, I like to think of it as a basketball game. That if your OCD is kind of focused on this one theme, you picture that guy with the ball. But if you're doing a really good job guarding that guy, he's going to toss the ball to somebody else, and your OCD is going to try to pop up in another place and scare you with a different theme. What you need to do is just kind of go over and defend that one. And so you switch your strategies in the same way that you'd be playing basketball, is that if your OCD is hopping themes, you do your therapy over to wherever the ball's going. For ROCD or POCD, I try to use a Seesaw example, which is the goal of therapy is to not get an answer on the yes or the no side. You want to, as uncomfortable as it is, picture your seesaw right in the middle with neither side touching and try to balance not getting an answer on either side, because most people are trying to put on trial like, I either am this way or I'm not this way, which the ideal for therapy is just sitting right in the middle with no answer. I also think of therapy as doing ERP, which can be very challenging and hard to get people into, I like to think of it as physical therapy. What we're doing is trying to train you to work a muscle that you haven't used. So at first it's going to be really painful. It's going to be super uncomfortable. It's not going to be enjoyable. So when you go to the gym, if you haven't been to the gym in 6 months, you don't come out of that workout saying, gee, I feel great. You come out of there sore and in pain. But over time, you build up this tolerance to that, and you build up that muscle that eventually you don't realize how, you're doing the same amount of weight or you're doing heavier weights and it doesn't have that same impact. And sometimes I refer to ERP like allergy shots, that when you are allergic to something or you have a very big bodily response to it, what we do is we introduce very small bits of that very substance to you and allow you to react and build up more and more and more, and eventually what happens is your body completely habituates to it and doesn't have the response to that substance. So one mindfulness technique that I commonly use with clients is the analogy or metaphor of the ocean, where if you think of your thoughts like the ocean, sometimes it's high tide, sometimes it's low tide, and sometimes there's a really big storm. And the goal is to kind of not resist, not stand in the waves. And if you try to hold yourself against the waves, they're going to knock you over if you try to resist them. But if you learn how to float and you learn how to kind of just go with them, you could survive high tide, low tide, or even the biggest of storms. So it's really about learning how to kind of, surf through those waves. And when your brain is kind of busy with those thoughts, just kind of being still, letting that storm pass because low tide will come again.